Good afternoon, ladies and gentlemen, and welcome to the Tuesday, February 27th, year 2024. You are at our Health Subcommittee of the House. Ms. Adams, if you could please call the roll.
Representative Hicks. Jernigan.
I'm present.
Leatherwood. Martin. Mitchell. Sherrill. Terry. Williams. Chairman Hawk.
I am here.
You have a quorum.
Thank you very much. Do we have any personal orders? I've got several. We have several, and what a great crowd we have here in the room today. Thank you all so much for being here. I will go down the list of some folks that we've got with us. First off, we have our Lipscomb University Nursing Program students. If y'all want to stand up real quick, it'll be the whole room standing up, so y'all stand. Let's give you a round of applause. As we are looking at workforce shortages in the nursing arena, thank you very much for your passion for caring for our citizens in the way that you are. So thank you very much for being here. We also have, it is Pharmacy Day on the Hill, and we have some pharmaceutical students in the room, possibly. Any pharmaceutical students maybe standing against the wall? Pharmacy Day on the Hill. Let's give our pharmacists a round of applause. Thank you very much. Also, we have Leading Age Tennessee Day on the Hill. Not sure if we have any folks from Leading Age, but it's their day on the Hill as well. Thank you. Let's give them a round of applause. And we've invited in our Tennessee Association of Nurse Anesthetists, our CRNA students are lined up on the wall. We had to get you a special request to get in here, so let's make them welcome as well. Thank you all so much. Any more personal privileges before we begin the calendar? All right, seeing none, we do have a substantial calendar before us, and we will begin with item number 1 on the calendar. The request on House Bill 2822 will be to roll for 1 week. Without objection, House Bill 2822 rolled for 1 week. We're now on item number 2 on our calendar. House Bill 2897 by Chairman Dr. Kumar. The request has been to roll this bill for 2 weeks. Without objection, House Bill 2897 rolled for 2 weeks. We are now on item number 3 on our calendar, House Bill 2007 by Chairman Haston. The request by Chairman Haston is to take this bill off notice. Without objection, House Bill 2007 by Chairman Haston is off notice. We are now on item number 4 on our calendar. Chair Lady Littleton. Do we see Chair Lady Littleton in the room? All right. Do not see Chair Lady Littleton at the moment. We will roll her until we see her come in the room. We've had discretion. I've taken privilege to do that in the past, so we will roll Chair Lady Littleton until we see her come in the room. We are now on item number 5 on our calendar. House Bill 2289 by Chairman Boyd. We're going to get cooking here, Chairman Boyd. You have your motion and you have your second. You're recognized for explanation, sir.
Thank you, Mr. Chairman, committee members. House Bill 2289 will hopefully address some of the staffing issues that we have in nursing homes and medical facilities around the state of Tennessee. It deals with medication aids. Now, medication aid is essentially a certified nursing aid. It's one step above that. And this bill would allow them to do 3 additional things than what they're currently doing now. They would first be able to administer metered dose inhalers without a spacer. They can currently do it with a spacer. This would allow them to do it without a spacer. It would allow them to administer a nebulizer treatment, and it would allow them to administer oral or topical drugs on an as-needed basis pursuant to nursing delegation without a prior nursing assessment. And just to remind everyone that they do work under a nurse. Mr. Chairman and committee, I'll take any questions.
Thank you very much. Any questions or comments for the sponsor? Question has been called. All those in favor of sending House Bill 2289 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman, Committee.
Thank you, Chairman Boyd. Item number 6 on our calendar, House Bill 2261 by Representative Wright. The request has been to roll this bill for 2 weeks. House Bill 2261 rolled 2 weeks without objection. We are now on item number 7 on our calendar, House Bill 2421. From Representative Shaw's office on House Bill 2421. Similarly to what we did with Chair Lady Littleton's bill, we will roll House Bill 2421 until we see Representative Shaw enter the room. We will now go to item number 8 on our calendar, House Bill 1883 by Representative Capley. Representative Capley is in the room. All right, sir. Do we have a motion? We have a motion. You have a second. You are recognized, sir, and I think you've been working on some amendatory language at the request of this committee.
Thank you, Mr. Chairman. Yes, sir. We got the amendment on there.
Can you give me the drafting code?
Yes, sir. Drafting code 014181. Is that right? I hope it's accurate.
All right. Yes, sir. That is accurate. All right. We are looking to, we have a motion. We have a second on amendment code drafting 014181. Let's go ahead and put that on and then have the discussion. All those in favor of putting the amendment on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended. You are recognized for explanation, sir.
Thank you, Mr. Chairman and committee. This legislation allows for individuals who are acting as a durable power of attorney in the healthcare system to receive daily in-person visitation with the patient to evaluate their condition. And again, Mr. Chairman, it's subject to regular hospital visitation hours. As long as the hospital, makes a reasonable effort, they're required to make a reasonable effort to ensure a minimum of 1 hour per duration for the visit. Again, this would not apply to those that are in the custody of law enforcement. It would also not apply to those that are undergoing a surgical or invasive procedure.
Thank you. And I think we had some concerns last week, and the amendment looks to address that. Thank you very much. Chairman Williams, you're recognized.
Thank you. Thank you for the amendatory language. I just had a follow-up. Would this revised language require hospitals or nursing homes to change their current visitation policies that they currently operate because of the power of attorney, or no?
Representative Capley, you're recognized.
Thank you, Mr. Chairman. To my understanding, no, I don't believe that it would. This would only, again, this is really looking at declared state of emergency such as COVID, et cetera, but it would just be during normal, regular visitation hours.
You recognized.
The reason why I was asking, I was trying to see I guess under would a family, the last time we had this discussion, I gave you an example about my dad, and let's say we didn't have a relationship and I was, not happy with him and didn't want to see him. Under the tenets of your language, the patient couldn't deny. In this case, I couldn't keep my dad from coming to see me. How does your amendment fix that?
You recognize Representative Capley, and I'll mention. I think the bill also designates the durable power of attorney. It's someone, and I'll let you address that, Representative Capley.
Yes, sir. Thank you, Mr. Chairman. Again, the amendment essentially makes it to where the patient would reserve the right to deny visitation to anyone at any time.
Okay, so that provision was not the case before? Okay. Under the power of attorney, is there a mechanism in the bill or in their operations or policies where if the patient did not want somebody who had power of attorney to see them, for the same reason I said before, a family member may have power of attorney, or an attorney may have power of attorney over someone, where that patient could still then say they didn't want to see that person? Or would the hospital be required to let the person who has the power of attorney see the patient, even though the patient doesn't want to be seen by that person.
You recognize, Representative.
Mr. Chairman, if you could word that question one more time, I'm not trying to be difficult. I'm
I'm not
trying to follow.
Thank you. I'm not trying to be difficult either. Under the premise, what I don't want to do is have an unintended consequence where we pass a bill and the patient's rights are somehow undermined unexpectedly by the adoption of the language. In any instance, I'm hopeful that the patient will always be the determining factor of whether somebody visits them or not, and not the family, power of attorney. I recognize that you've taken it out when it comes to those in police custody or something like that. But that's what I have a concern with. I just really feel like that it should always be the patient that decides based upon their relationship with the person who wants to see them.
You recognized.
Thank you, Mr. Chairman. To my understanding, that's what the amendment would do, that the patient would reserve the right to deny any person at any time.
Okay. Thank you.
Chairman Williams, I think that we could go into recess and allow legal staff Caroline to read that sentence that will hopefully address your concern. Without objection, we'll go into recess. Ms. Miller, if you could introduce yourself, tell us who you are and address the concern.
Sure. Caroline Miller, Office of Legal Services. So we've added in new amendatory language. It is in section 1B4 and section 2D. So the principal can limit the visitation rights specified in this bill either by indicating the limitation in the power of attorney or by notifying the healthcare provider orally or in writing that the principal declines a visit. So they can just make that known to their healthcare provider.
Thank you.
Any further questions while we're out of, forgive me. Any questions while we're out of session? Okay, we'll go back into session. Further questions or comments for the sponsor? Seeing none, are you ready to vote? All right. All those in favor of sending House Bill 1883 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you very much. All right, we are now, Chair Lady Littleton has returned to the room. My apologies, Representative Freeman. I had rolled Chair Lady Littleton till she got back in the room.
Thank you, Mr.
I'm
Chairman.
going to have to make up to Representative Freeman now. I apologize. We are back on item number 4, House Bill 709. Chair Lady Littleton, do we have a motion? We have a motion. We have a second. You are recognized on your bill.
It does have an amendment, 5918.
All right. We are looking at drafting code 005918, which will rewrite the bill. Let's go ahead and get the amendment on the bill. Do we have a motion? We have a motion. We have a second. All those in favor of placing amendment drafting code 005918 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. We're now on your bill as amended, Chair Lady.
Thank you, Mr. Chairman. And I apologize. Not only is it busy, but it's hard for a short person to get around in these halls. It is so crowded out there. So I appreciate your patience. So I'm here to introduce House Bill 709 as amended, a bill to promote self-sufficiency among able-bodied adults on food stamps. For most of us, work has been a huge part of our life, and we know that work is about a lot more than just a paycheck. It forms a big part of our identity. It fills us with sense of pride, and it allows us to form connections that last a lifetime. Work is a huge part of Tennessee's world are relocated to Tennessee because of the strength of our workplace, not welfare. Unfortunately, there are a lot of workers sitting on the sidelines. Many able-bodied adults without dependent children receive food stamps in Tennessee, depriving businesses of needed workers and the truly needed from getting the benefits they need. Our food stamp program has become a full of able-bodied adults who don't actually need the benefits, that our improper payment rate is the one of the highest in the country. Almost 20% of food stamp benefits are lost directly to waste, fraud, and abuse in Tennessee. This has not happened by accident. Even though there are federal work requirements, our state uses loopholes favored by states like New York and California so that many-bodied adults in this state do not have to comply with the program or work requirements. This bill would change that by requiring that the agency seek the legislature's approval before they submit a waiver and have a good cause before they exempt a bodied adult from work requirements. We can ensure that benefits are being preserved for the ones who truly need them, and that there are workers available to fill the open spots. The bill only applies to able-bodied adults, not children, the elderly, or the disabled people, and will be a positive step towards ensuring that Tennessee remains one of the world's top business destinations. With that, I'll take questions, and I think we have some people to testify to.
We do. We do have some folks that would like to speak on the legislation. Do we have any questions or comments at the moment? We will go out of session. There is a gentleman, Sam Adolphson, was with the Opportunity Solution Project. We will go out of session. Mr. Adolphson, if you could please come up, and you can either find a seat or speak from the podium, wherever you're comfortable. There we go. Mr. Adolphson, if you could, and forgive me if I'm butchering your name, but if you could introduce yourself, tell us who you are and who you're with, and then what you'd like us to know on the bill. You've got 3 minutes, and then potential for questions and answers after that. You are recognized, Sam.
Thank you, Mr. Chairman. Great job with the name. My name is Sam Adolphson. I'm a visiting fellow at the Opportunity Solutions Project. Before I joined the Opportunity Solutions Project, I was the Chief Operating Officer at the Maine Department of Health and Human Services. We oversaw the food stamp program in Maine, among other programs. Just a couple quick notes on this bill. The first thing, as Representative mentioned, it is the food stamp program, the SNAP program. This is not TANF or any of the other WIC, any of the other welfare programs here in the state, public safety net programs. It is the food stamp program only. This particular bill applies to able-bodied adults without dependents, and there are about 60,000 in Tennessee. These are folks who are not disabled, between 18 and 52 years old, and they do not have dependent kids in the house. So that's the only group that this bill would apply to. And what it is, as the representative talked about, this is a work requirement. This is in federal law to work part-time, 20 hours a week, be in training, or be in education in order to continue receiving the food stamp benefit. And that work requirement works very well. It's been implemented in states across the country. We've tracked participants in those states. Their incomes have doubled within 1 year of leaving the program, tripled within 2 years on average, and they go back to work in thousands of industries, which is important. You have 190,000 open jobs here in Tennessee, so of course you need all the workforce help that you can get, and these folks are able to fill some of those jobs. So what this bill does, the good news is that your commissioner, Commissioner Carter, and Governor Lee have done a great job in getting this work requirement online. And so right now, this work requirement already applies to those folks in the state. And that puts you in the category of Florida and Texas and many other states who do that. So they deserve credit for that. And I think it's a reflection of where you want to go with your economy. What this bill does specifically is there is an available waiver of that work requirement. You can waive it completely with permission from the federal government. And Tennessee has done that in the past, even with unemployment rates like 5%. This bill simply says that work requirement that's online right now should remain in effect unless the legislature approves a pause or stop in the work requirement. So right now, the federal government can work directly with your agency and pause that requirement. Under this bill, they would have to bring that waiver forward to you for review before they submitted it to the federal government in order to have that work requirement paused. So really, it's about transparency and oversight of that particular work requirement and waiver process. Florida, Kansas, West Virginia, Idaho, North Carolina are some of the states that require this type of legislative approval on this particular work requirement right now.
Thank you. We've hit our 3 minutes. So
Thank you very much, Mr. Chairman. I'm happy to stand for questions should folks have them.
Thank you. Any questions or comments for the presenter? Representative Chairman Williams, you're recognized.
Thank you. Thank you for your testimony. I just had an interesting thought. So as it relates to the cost associated with this, it looks as if the cost would go up. It would seem to me like if more people were getting to work and you don't have an end around using the federal bureaucracy to do that, why does it cost the state and the federal government more?
You recognize, sir.
Thank you, Mr. Chairman. Representative, that's a good question. I think the department might be able to answer why they arrived at that particular fiscal note. I think what we've seen in other states is that sometimes when they do calculations around the costs, they're not factoring in that there will be a decrease in enrollment that would require less administrative burden when these folks go back to work and get into paid employment. So maybe they missed that side of the math. I don't think, from my experience, and we did not have this waiver when I was in Maine. We stopped using the waiver. We didn't see an additional cost from that. We didn't have to hire any new staff. And other states that have gone down the same path of saying, hey, let's have the legislature weigh in if we want to stop this work requirement, we haven't seen fiscal notes. They've been $0. So not exactly sure why there is one on these, particularly these first two provisions here, A and B.
Mm-hmm. Recognized.
Thank you. So under you may or may not be able to answer this question, but if what would be a normal example in your mind of when someone might need a waiver and it would be acceptable? I mean, I just wondered if you agree that there might be a possibility that someone would need a waiver for a short period of time.
Representative, Mr. Chairman, great question. So there's two different things at play here. The Section A is a waiver across everyone in either the whole state or a portion of the state. And so that really is called a geographic waiver, and it's just considered a blanket waiver. And it was designed by Congress originally to be for tough economic times, which made sense. They said, hey, if unemployment's 10%, we're going to pause this work requirement. During the Clinton administration, the regulators put in some different rules that allowed states to get this even when unemployment is as low as 3 or 4%. So really the whole purpose of that is if there's a really tough economy. In that case, the department would come in with the plan and say, hey, in these 11 counties, we want to stop the work requirement because of these economic factors. You'd review that and sign off if the economy was set up that way. The other piece of that is there are a number of exemptions built into federal and state law already for folks with the work requirement. So if they're in substance abuse programs, they're considered to be complying. There are good cause exemptions that apply for illness, family members' illness, difficulty with transportation, and things of that nature. So there's already a pretty good base layer of various exemptions to the requirement.
Yeah, thank you.
Thank you. Chairman Jernigan, you're recognized.
Get that? Thank you, Chairman. So do you feel that Tennessee is currently abusing their waiver privilege?
Mr. Chair, Representative, Tennessee has in the past. I've looked at these waivers going back a couple decades in every state. And pre-COVID, if you get back into kind of post-Great Recession, 2010, up through the beginning of COVID, Tennessee did have a waiver of this work requirement in place that, for example, waived the requirement in a number of counties that had 5% unemployment. And so what that means is clearly there were jobs available in those counties with low unemployment and open jobs, and yet they were still applying for and receiving that waiver. And one of the things we saw is that during that time period, states were under a lot of pressure from the federal government, from the Obama administration, to get those waivers, because that administration and the current one they don't support work requirements. Now, what we've seen in Tennessee is that I mentioned your governor and your commissioner, who speaks very well about how important work is, not just to the economy but to the person. They've seen fit to go ahead and stop with that waiver, which I think is great. The issue is that should they not be in those seats someday as we go forward, that the pressure from the federal administration may result in those waivers being abused again without the proper transparency and oversight of the legislature.
You recognized?
So what's your definition of abuse? So if it's a county that's 5% and they gave 3 waivers, is that abusive, or what, or is it higher than that? Is the percentage?
You
I need
recognize?
some numbers or a
Sorry.
percentage.
Absolutely. Mr. Chairman, Representative. So what happens with these geographic waivers is it actually applies to the entire area and everyone is exempt from the work requirement in that entire county, or in some years in the past, Tennessee was even statewide, where no one was subject to the work requirement because this waiver was submitted and approved by the federal government. And so what I would describe as abuse, or maybe fraud by design, if you will, is that the state, they're allowed to pool together counties to achieve a certain number that gets an approval on this. So for example, you take a low unemployment county, 4%, and you combine it with a high unemployment county, 8%, and now you've achieved the particular average that you need to get awarded this waiver. And the net result being a bunch of folks in an area with plentiful jobs no longer have to look for work or go to work.
You recognize?
Okay, so I don't guess you answered my question. You say a bunch of folks.
Yeah.
What's the number? Is it 3? Is it 5? And what percentage? Where is it abusive to you? Because for me, a waiver is something you can't think of right now. Why it's a good idea to give discretion to the department. I can't even think what the reason is, but to take that away and to say that it's abusive, I want to know what that number is, what that percentage is for you. That if it's 2, or is it 3, or is it a percentage of 15, 20%? Because you're just saying it's a blanket waiver. I want to know what your idea of abuse is.
You recognized?
Mr. Chair, Representative. So there's 2 sections of the bill, right? Section A is the geographic waiver that I described. You have approximately 60,000 able-bodied adults with no kids in the house between 18 and 52, subject to the work requirement. In previous years in Tennessee, and currently in many other states, that waiver that's covered in Section A of HB 709 is waived for everyone. So in the past in Tennessee, we're talking about 50,000, 40,000 people where the state has applied a blanket exemption. Now, Section B, which you're mentioning a bit, I believe these discretionary exemptions, this is an allotment given to the department that if somebody is subject to the requirement but doesn't meet good cause, like they miss the work requirement for no reason, they're not ill, they're not taking care of someone sick, they have transportation, all these other exemptions, department can still apply an exemption. After they get through all those, if none of them meet, they can come in and say, all right, you're exempt from the requirement. And they're sitting on about 250,000 of those exemptions. And so the suggestion here is that we shouldn't be exempting folks from the work requirement without that big of a policy that affects so many people and your economy without coming back through the legislature for a discussion about should we use these.
I'll make it brief.
We'll wind it down here.
You-
Recognize you,
yeah,
Chairman
You
Jurgen.
mentioned 55,000, 60,000. You mentioned $250,000, and I'm going to ask DHS the same thing of what that is. But give them discretion, and you're saying maybe it's a good reason or a bad reason, but we're talking about food for someone eating. It's not cash benefits. It's not, we're talking about someone who calls up and for some reason that is legitimate, that they need food is what we're talking about. And you want to get rid of that discretion for them to do that. Is that correct?
You recognized.
Representative, just a little clarification on that. So what these are all folks who already receive food stamps, right? So they're, by definition, those 60,000 able-bodied adults are on the program now.
Okay.
And so they have a work requirement that's in federal law that they have to participate part-time, volunteer, be in training in order to continue receiving that food benefit. And this would just say that if you're going to exempt them from that, we got to have a conversation about that in the legislature. This isn't taking food from anyone in any respect. All it's saying is that the work requirement, which is shown to help people transition from government dependency back to self-sufficiency and into paying jobs, that will stay in effect for these folks.
One last comment, I'm done.
You recognized.
The definition of a waiver is because there's a good reason to waive the general policy. And that's where I think the discretion belongs to the department to do that. Thank you, Chairman. I'm done.
Representative Mitchell, you're recognized.
Thank you, Mr. Chairman. And you're asking us to get involved, and I see that as micromanaging the departments. The federal government, the state government, we issue waivers to give these department professionals some discretion. Reading your resume, and I think several people from your organization came from the Maine legislature, and you know how legislature works, not very fast most of the time. And as my colleague said, we're talking about food. We're not talking about a PPP loan they can go buy their Ferrari with. We're talking about food for survival. So, it's kind of, I've got to trust the people we put in charge of the departments to have good judgment. And, instead of me passing another law, if they don't have good judgment, maybe we just exchange the people we have in the departments. That's a whole lot easier and quicker than us, passing more legislation up here. Thanks.
Would you like to respond?
Yeah, Mr. Chairman, Representative, just clarification. I was not in the legislature. I was in the Department of Health and Human Services there. And just one note on that, the specific waiver here in Section A, I was part of the department that would organize that information and put it together for the folks in DC that approved or denied those. And that's a lengthy process in itself. So it's not like the department is doing those overnight and submitting them. There would be quite a bit of time on their end as well that would give them an opportunity to come forward to the legislature and just say, here's what we're thinking based on the economic conditions of various parts of the state, and get you all to weigh in, make sure you're all on the same page. So just a clarification on that it isn't an overnight process. So the pace, I don't think, would be affected whatsoever on that front.
Thank you. Any further questions? Chairman Leatherwood, you're recognized.
So did I understand your description before with the waiver has been done in Tennessee in the past and could continue being done, that there are blanket waivers for a whole county or multiple counties? Is that correct?
Representative, yes, sir. That's correct. The waiver is designed around counties or statewide, and that those are pulled together in the waiver. And whether or not the federal government would approve it is based on some factors, including the combined unemployment rate of those counties.
You recognized.
And so in that case, they're not always specific to an individual's needs, where one individual circumstances have changed. They can't go out and look for a job, but other individuals in that county, their circumstances have not changed. So it's not necessarily specific to the individual's needs as it is now. Is that correct?
You recognized.
Mr. Chairman, Representative, that's exactly right. They're applied broadly across the geographic region versus person by person. And that's the waiver in Section A, because the exemptions in Section B are of a different nature.
Okay. And last thing, with this, someone doesn't necessarily have to go out and find a job, but they would need at least be looking for a job. Is that correct?
You recognized.
Mr. Chair, Representative, that's correct. There are multiple options under the federal law on the work requirement. It's to work 20 hours a week in paid employment. You can volunteer often as little as 8 or 9 hours a week in various ways, volunteer-wise, and then you can be in job training as well. So that your employment and training programs, your DOL programs, adult ed, all those various things, if they're participating in one of those, would apply also.
Okay. And last thing, I know we can all come up with horrible circumstances where someone does deserve a waiver, but I would think, listening to it all, that if those circumstances change, they would fall into one of the categories you listed that it wouldn't apply to. And just to refresh my mind, what were those categories of individuals, disabled, whatever, where it wouldn't apply?
Yes, sir. Mr. Chair, Representative, there's a long list of exemptions in the federal law, and I definitely can get the committee that full list. But just to give you a few, if there's any kid in the household, if there's someone who's incapacitated that the person is caring for, if the person's over age 52, if the person is in substance abuse treatment, they'd be exempt. And there's kind of a longer list beyond that. And then that's before you get to what we call good cause exemptions, which if I'm sick, if my family member's sick, if there's the road's out because it flooded, if there's, I'm having trouble with my car. So all of those, if this bill passed today, all of those things would still apply. All of those individuals would still be exempt from the work requirement.
Thank you. Further questions or comments? Thank you very much.
Thank you,
Mr.
Mr. Chair.
Edelson.
Committee.
Thank you very much. We do have on the list requested to testify as well. We have from the Tennessee Department of Human Services, Mary Dobbs and Callan Schmidt-Baggett. If you all are here. Looks like we get Callan today. You know the routine. If you could introduce yourself, tell us who you are and who you're with and what you'd like us to know. Again, we'll have 3 minutes in conversation and then Q&A after that. So you are recognized.
Good afternoon, Chairman. My name is Callan Schmidt. I'm an Assistant Commissioner with the Department of Human Services. First of all, I want to say thank you to Chair Lady Littleton for starting this conversation. I think we're all trying to get to the same place, but we're going different paths. As the previous spokesman said, my commissioner is very passionate about getting people back to work, and I'd love to tell y'all more about that when we have more time. We are still opposed to this legislation. The department rarely uses this waiver and in very specific circumstances, which I would be happy to outline. We do not waive broad groups of people and broad geographic regions anymore. We are authorized by the federal government to issue up to 60,000 of these waivers. We used this waiver authority for 1.5% of that 60,000 last year. And I want to give you a specific example of when we used that so you can understand why the department is so opposed to this. We used that when the federal legislation changed. the ABOD requirements. And so there were groups of those individuals who were required to work. And the federal government, quite frankly, made us implement this law before our system could adapt to it. And that is typically when we see the use of this system. Ultimately, we needed to create this discretionary waiver for homeless veterans and for veterans to make sure that they did not lose their SNAP benefits and the ability to eat because our computer system could not keep up. So that's when we waived it last year, and that was a total of just about 800 people total. If this bill were to pass, it would take away our ability to provide food to our customers in a timely manner. You all would have to come back into a special session, and then we would have to get those benefits out the door through that verification process. I don't think I'm hiding anything by saying we've had some problems with that in the past 6-7 months. So we need to make sure that we can get food out the door and verify that those folks are eligible for SNAP. It would also hamper the department's ability to adjust, and it would take away a tool in our toolbox for us to work with our error rate. Right now, we are currently at an 18% error rate, as Chair Lady Littleton talked about, and unfortunately, that is above the acceptable 6%. We are in the first year of probation. If we're in 2 years of probation, we are at risk of paying state penalties to the federal government. Thank you. I'll be happy to take any questions.
Thank you. So I think the numbers there, and Chairman Jernigan is going to be recognized, may go down that. You said 1.5%, between 800 and 900 individuals.
Yes, sir. That was in 2023.
Okay. Chairman Jernigan, you're recognized.
Yes, and you answered the question, especially the one of when you use it and who you use it for and the low numbers. But I wanted to point out, you talked about the system. That's a perfect example of what I was talking about, of what you can't think of, why you would have a discretionary waiver. Clearly you're not abusing it like it was asserted before, but to have discretion in your back pocket for something that you just don't know what's coming down the pike. And that's just a tool to feed people. And this is where I'm at. So, thank you for clarifying with some facts of the previous testimony. So thank you, Chairman.
Thank you. I will ask, and Chairman Carter has become a fast friend of mine since he's been in Tennessee. And you mentioned, and time is getting away from us here, we've got other bill sponsors, but in the room, tell me what are some of the things that Department of Human Service are doing to get folks into the workforce? Can you remind us of those, please?
I'll talk fast. One project that I specifically want to highlight that really affects Representative Martin's area is the Employee Absenteeism Engagement Initiative. This is a pilot project that we procured a vendor for past year and a half, and it's for folks who are eligible to work and are not in the system. We are not denying that those folks exist, but what we are doing is we are getting them back into the workforce and figuring out what's the hurdle. Can they not get a suit for an interview? Do they have transportation issues? So we're connecting with the nonprofits in that community to say, hey, Representative Martin, you have a job interview. Let me get you what you need to get there. That's how we fix this problem.
Thank you. Any further questions or comments for the Department of Human Services? All right, seeing none, thank you very much. All right, we are going to go back into session. And Chair Lady Littleton, you are recognized and recognized, and then we'll go for any questions or comments that may be. Chairman Williams.
Thank you.
You're recognized first.
Should have waved. Thank you, Chairman. Mary, Representative Littleton. Sorry, I'm used to Mary. She's also a representative. She's also a mom, but I didn't say that.
She's like our big sister.
Chair Lady, Chair Lady Littleton, my apologies. I have systematically voted for work requirements. I believe that able-bodied people should return to work if they have the ability to do it. I also understand the department's concerns as it relates to having some flexibility in regards to this. I think you have a good opportunity here to fix something, but I'm a little bit concerned that maybe it's not fully developed. And I have quite a few questions still left myself. I don't know for the purposes of saving time and also being able to kind of get through the calendar for most of us. I was wondering if you'd be acceptable, maybe us rolling this 2 weeks. You and I talk about it a little bit. I know there are some other members probably on the committee that also have some questions with the idea that we might, if we want to move forward with the bill, we could do that. But also, as you're aware, I serve on TASER, and it's a great place to study these kinds of things. I have a couple of bills there. I have to come all through the summer when you guys are, doing what you do. And so
I'm here on GovOps.
yeah. And so I think it might be a possibility, but I don't want to make a motion to send it there until I fully understand what we're doing. So wondered if you'd be amenable for us to roll in this 2 weeks, you and I get together and then coming back.
And I will interject at the moment. This was a bill that we had broad discussion on last year as well. And we are in the posture of other bills where upon rolling, this bill would go to a special calendar, which would be held after our final calendar, which is upcoming. So it would still meet a similar posture, although it may be more than 2 weeks. It might be a 3-week time frame or potentially 4-week time frame before it was called up. But it does give time for discussion if that is the direction you're liking to go, Chairman Williams and Chairman Littleton. You recognize
Can I
Chairman
say-
Littleton.
Thank you, Mr. Chairman. I would agree to that, but I would like to say that no one is wanting to take food from anyone. It's from able-bodied people that are able to work. And that does take food from other people that are disabled and children. So but no one wants anyone to go hungry. So I want that on the record.
Point very well taken. And thank you for reassuring us of that, Chair Lady Littleton. I'm hearing
For the purposes of the chairman's discussion, I think last calendar or final calendar or 2 weeks or 3 weeks would be fine.
Yeah.
So if the motion needs to be last calendar, we could do that, whichever your staff deems necessary.
I think we'll take the motion will be to roll this bill to the special calendar at the end of this committee, which will get us in the posture that we need be. Seeing that without objection, we will roll House Bill 709 to the special calendar to be held after our last calendar. Without objection. Thank you, Chair Lady Littleton.
Thank you, Mr. Chairman and committee for working with me.
Great
Appreciate it.
discussion. Thank you very much. All right. My deepest apologies to gentleman who sits close to me on the House floor, Representative Freeman. We are now on item number 9 on our calendars. House Bill 2233. You have a motion. You have a second. You're recognized, sir.
Thank you. I'd like to take a moment of personal privilege for 1 second.
You're
Welcome to
recognized.
Lipscomb students. I'm a graduate, and I sent out a call, and they are all coming to support my bills today. So thank you. Thank you for being here. So thank you for that. Chairman.
Yes.
House Bill 2223. I'll need that. Yeah.
2233.
2233.
Yes, sir.
Expands the eligibility for the Smart Steps Child Care Payment Assistance Program for parents or guardians whose
Do we have a
incomes-
motion? We have a motion. We have a second. Yes, we've already taken that. Thank you very much. Sorry, you're recognized.
Sure, is less than 100% of the state median income. What this is trying to solve for is that middle income Tennessean that doesn't makes more, still needs assistance, but makes too much to get it. And so what this is 100% or less of median income, they would be able to apply for the Smart Steps Child Care Payment Assistance Program.
You've heard the explanation. Chairman Terry, you're recognized.
Thank you. Appreciate you bringing the bill. Now, I understand this does have a fiscal note on it.
It does indeed. Yes, sir.
And is this, are these funds paid for through the Child Care Development Fund?
I believe they are.
Okay, I'm getting a yes back there. And do you know how much is in that fund? And we have resources. I'm getting a thumbs up to cover this potentially. Could we go out of session here from DHS?
DHS is on the list if we need something beyond a head shake or a thumbs up.
I think I saw a thumbs up.
I thought, yeah. let's go out of session and, yeah. If that's okay.
All right, we do have a question for DHS, and we do have. I'll let you. There has been a question. Is there a limit to the number of times the department can talk in committee? And that would have to be committee rules. We could probably have discretion broadly on that. So we will go out of session. You are recognized. Please introduce yourself. Tell us who you are and who you're with.
Callan Schmidt, DHS, we appreciate discretion. I will say that this bill, currently this program is covered by CCDF funds. We get about $220 million a year. It fluctuates depending on the yearly award. This bill would cover the 15% above the 85th with state dollars, which is why it has the fiscal note. So that is why it has the fiscal note. It would require state dollars instead of CCDF dollars.
You recognize Chairman Terry.
So how much do we have in reserves or what from CCDF?
I don't have that number in front of me. I'd be happy to follow up with you. We have seen increased utilization of those dollars with grants and a higher market rate that we provide to providers now. I will have to get you the reserve number at a later date.
You recognized.
And is there some reason, and this may be a question to the sponsor of the bill, is there a reason that CCDF dollars can't be used for this, or is that federal?
Federal guidelines don't
Okay.
let us go above 85.
Thank you.
Thank you. Any further questions or comments from the department? All right, thank you very much. We are back in session. Representative Freeman, you are recognized.
I renew my motion.
Stands for questions or comments? Questions or comments? Are you ready to vote? And all those in favor of sending House Bill 2233 to full health committee, please signify by saying aye. Any opposed, please say no. If you do vote no, please let the clerk know your vote on that. Thank you very much. House Bill 2233 moves to full health committee. You're now recognized on House Bill 2405. Representative Freeman, you're recognized.
Thank
you.
you.
Have a motion? We have a motion? We have a second.
So
You
we
are
also have a-
recognized 2405.
I have an amendment, code 14077.
All right, we have drafting code amendment 014077. You have a motion, you have a second. We'll go ahead and place the amendment on the legislation. All those in favor of putting drafting code amendment 014077 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended. You've taken up a lot of paper to file this bill with the committee. You're recognized, Representative Freeman.
So we're just trying to make sure that everything is covered. So this is the social work licensure compact, and it's an interstate occupational licensure compact. And the main reason for this is to allow for freedom of social workers to move and practice where we have a reciprocal agreement and other people that are within this compact. In many parts of our state where we have neighboring states just right across the line, this will allow those people to be gainfully employed, and it will also help spouses of military that are deployed and move to Fort Campbell and allow them to work in other states that are part of this compact, or if they were a member of the compact before they left.
Thank you. Any questions or comments? Question has been called. All those in favor of sending House Bill 2405, all those in favor of sending House Bill 2405 as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman, committee, and my cheering squad out there.
Thank you. Go Lipscomb. Remind me your the mascot Bisons. My daughter Bisons. My daughter took a trip to Lipscomb upon graduating, and she enjoyed her time there. So thank you very much. We're now ready for item number 11 on our calendars, House Bill 2081 by Representative Alexander, making her way to the podium. We have a motion. We have a second. Representative Alexander, upon reaching the podium, you already have a motion and a second. You're recognized on House Bill 2081.
Thank you, Chairman, and thank you, Committee. The bill I bring before you today comes to us from PSSAs. Those are personal support service agencies. They are licensed under Title 33 so that they might administer medications to an individual who is incapable of self-administration in the individual's place of residence after the person has satisfactorily completed a competence-based training program approved by the Department of Mental Health and Substance Abuse Services. The unlicensed personnel referenced in these subdivisions shall not administer intravenous, intramuscular, or certain subcutaneous injectable medications as defined by the rule. The unlicensed personnel referenced in the subdivision shall not assist with self-administration of vaginal medications, rectal medications, intravenous, intramuscular, or certain subcutaneous injectable medications. And I probably butchered that word, but I'm not a medical person, so please forgive me, Committee. The Department of Intellectual and Developmental Disabilities, which we call DID, in consultation with the Board of Nursing, shall promulgate their rules, including emergency rules, to provide for competency-based training, education, and appropriate monitoring. Basically, this just allows the people that are in the home to administer the medications that the person normally takes on their own without any kind of injection or anything else. They will follow the same protocol as DID. And lots of times these caregivers are going from that house taking care of an elderly person to a home where a DID patient is waiting on their care. And it's just nice if the rules are all the same and they know what they're doing.
Thank you. And Representative Alexander, forgive me, you've described the bill very well as amended. And we
Yes.
do have an amendment. We have a motion on the amendment, drafting code 014291. All
That is
those in
correct.
favor of placing that amendment on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. And you've done a great job of describing the bill with that amendment on there. Thank you. Any questions or comments for the sponsor? Chairman Jernigan, you're recognized.
I just want to say thank you for bringing this. I'm a co-sponsor of this bill. Just give her an example. When I was a young man and I was in an accident, broke my neck, and I had caregivers come in, and there would be times when I had a caregiver come in and my medication was it just got placed about 6 inches away from where I couldn't reach it. And the caregiver by law could not hand me the bottle.
Yeah.
That's ridiculous. So this fixes that problem. Thank you so much. I'm ashamed I didn't bring it in the past, but I've been thinking about it for years, and I'm going to be with you through this whole process. Thank you so much.
Thank you.
Thank you, Chairman Jernigan. I think this is certainly what we are engaged to do in the legislative process, is come up with solutions. And Representative Alexander, thank you very much for leading the way on this. Are you ready to vote? All those in favor of sending House Bill 2081 as amended to full health committee, please signify by saying aye. Aye. Any opposed, please say no. Your bill moves forward. The ayes have it.
Committee. Thank you, Chairman.
Thank you. All right, we're now item number 12. The request, I think Representative Hale is in another committee at this moment, so we will make the motion for Representative Hale to be rolled, I'll say, to the heel or to when he gets in the room. Without objection, item number 12, HB 1916, roll to when Representative Hale gets into the room. We're now on item number 13 on our calendar, House Bill 2474 by Representative Raper. Is Representative Raper within earshot? All right, we will do the same with that bill. We will roll that to the heel or till he comes into the calendar. House Bill 2474, roll to the heel or to when he comes into the room. We're now ready for item number 14 on our calendars, House Bill 1969 by Chairman Jernigan. Do we have a motion? We have a motion. You have a second. You are recognized, Chairman Jernigan.
Do I have an amendment? I think.
You do have an amendment. I think we've got drafting code 0139. Didn't turn quite the page there.
14009, 14029.
We have amendment drafting code 014029. You have a motion. You have a second. Let's go ahead and get that on the bill. All those in favor of placing amendment drafting code 014029 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill is amended for discussion. You're recognized, Chairman Jernigan.
Thank you, Chairman. This bill is amended. Members will allow for the alignment of the 2021 International Building Code and the International Fire Code requirements for carbon monoxide alarms and daycares that will soon be adopted by the State Fire Marshal's Office. The bill codifies the carbon monoxide alarm requirements for daycares. We've worked with the Department of Commerce and Insurance, Department of Human Services, as well as State Fire Marshal. What it'll do is require that each child care agency have a carbon monoxide alarm in every room where child care is provided to children. It establishes that each day a violation occurs, a separate Class C misdemeanor, which is the same violation of not having a fire alarm. Last, I'll say that a carbon monoxide monitor alarm costs anywhere between $10 and $15. I'm happy to go through the genesis of this bill and where it came from, but Chairman, with that explanation, I'm happy to answer any questions.
Thank you very much. Any questions or comments for the sponsor of the bill? Chairman Williams, you're recognized.
Thank you, Representative Jernigan. Could you tell me, based on the way the amendment reads, it doesn't go in every room. So it'd be like in the classroom space or the cafeteria, but not in the offices or anywhere else. Or is the intent for it to be in every room?
The tent will be in every room where the children are.
Okay. Yep. Thank you.
Thank you. Further questions? Are you ready to vote? All those in favor of sending House Bill 1969 to full health committee as amended, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman.
We are now on item number 15 on the calendars, House Bill 1682 by Representative Martin. Got a motion? You got a second? I think we're having some discussions. Okay. Any objection? All right, hearing no objection, the request from the sponsor is to roll House Bill 1682 for 1 week. Without objection, the bill is rolled. We're now on item number 16 on the calendar, House Bill 2502 by Representative Harris. Do not see Representative Harris in the room. So we will do similar to the other representatives that we have rolled to the heel or to when they come into the room without objection. Forgive my delay. I'm still very tactile. I have a paper notebook here, so I'm turning through the pages. We are now on item number 17 on our calendar, House Bill 2522 by Chairman Terry. You have a motion. You have a second. You are recognized, Chairman Terry.
Thank you, Chairman Committee. This bill authorizes the Board of Osteopathic Examination to issue advisory private letter rulings upon request to affected licensees regarding matters within the board's primary jurisdiction.
You've heard the explanation. Any questions or comments of the sponsor? Question has been called. All those in favor of sending House Bill 2522 to full health committee, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and Committee.
We are now on item number 18 on the calendar, House Bill 2371, again by Chairman Terry. Do you have a motion? We have a motion. We have a second. You're recognized on House Bill 2371, sir.
Thank you, Chairman and Committee. This bill increases from 48 hours to 2 business days the time in which a physician in charge of a patient who dies or a medical examiner must determine the cause of death and complete and sign a medical certification of death.
All right. You've heard the explanation. Any questions? Question has been called. All those in favor of sending House Bill 2371 to Full Health Committee, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman and Committee.
Thank you. We are now in a posture where I have a couple of bills up. I've got items number 19 and number 20, and I'm going to pass the gavel over to Chairman Terry.
All right, we are on item number 19, House Bill 1971 by Chairman Hark. You have a motion and a second. You are recognized.
Thank you, Mr. Chairman and members. As we began the TANF Opportunity Act and the pilot programs therein, we had a considerably ambitious timeline to get information back from some of these pilots. I've been blessed to serve on a advisory council, and we heard some tremendous reports on Thursday of this week of what our TANF Opportunity Act pilots are doing in terms of us being able to gather the valuable data and information that we need to make good decisions on what programs are going to have value going forward. We need a little additional time to do that. That's what this bill does, is allows our pilot programs and the Department of Human Services to extend that time a little bit, once again, so we can gather the very important information that we're looking. That's what it does, Chairman and members.
All right. Any questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 1971. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to full health.
Thank you.
That brings us to item number 20, House Bill 1973. Chairman Hawk, you are recognized. You have a motion and a second, and I believe there is an amendment.
Yes, there is an amendment. The drafting code is 014247.
All right, you've heard that. We have a motion and a second on the amendment. If there's no objection, let's go ahead and get the amendment on the bill so we can get in proper order. All those in favor of amendment 014247 say aye.
Aye.
Opposed? Ayes have it. We are on the bills amended. Chairman, you're recognized.
Thank you, Chairman and members. And I can go into as much detail or as little as we like. This is a bill that has been very important to me for quite some time. It deals with newborn screening and specifically the recommended uniform screening panel. Right now, we've got almost 70 different conditions that we are testing in that little blood prick that you see in an infant's heel whenever they're born. We were able to detect many maladies that could follow this child early on, and early detection has been critical in treatment for these youngsters going forward and improve their lives dramatically. What this bill essentially does is say that the Department of Health will continue their current screening process of evaluating and adding conditions should they come before us. If a condition is approved if and when a condition is approved by the RSUP and is not added to the screening panel within 36 months, the Department of Health will write a report and tell us why. So what this is encouraging us to add these different diagnoses as quickly as possible to ensure that we're taking care of Tennesseans as quickly as possible as well. Our Tennessee Department of Health has done a very good job. We are actually a national leader in this and adding the different conditions to the list. And Tennessee Department of Health has done a great job. This is just going to empower them to continue to do a great job. So again, Chairman and members, as amended, that's what this bill does. And I must thank several folks. The Department of Health has been great to work with in crafting the amendatory language as well. So stand for your consideration, Chairman and members.
All right, thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 1973 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to full health.
Thank you,
And
Chairman and members.
hand the gavel back, and it looks like we have some members that have come in. So
Forgive me. All right, ladies and gentlemen, we are going to go back in order. We are back on item number 12 on our calendar. Was the first to be rolled till someone came back in the room. And then Representative Hale, you are recognized. We'll let you make your way. All right, we have House Bill 1916 before us. Hear a motion, and I hear a second. You are recognized. Just one moment. We've already taken a vote on the amendment. This bill was rolled from the prior week, and we encouraged all parties to have a discussion on this particular piece of legislation. Representative Hale, you're recognized.
Thank you, Chairman and Committee. Since last week, had the opportunity to have a good conversation with TDS, and I want to thank you, Chairman Hawk, and the committee. But I also want to thank TDS. I've talked with the THA. So what we've agreed to do is we're going to take this bill off notice. What we're going to do is they've promised to the stakeholders, to everybody, to work over the next year, see if we can get to a good place. If we can, and we have to move forward with something, we can. But and I'm thankful that they've agreed for me to be involved in those conversations as we work through with all the stakeholders. So I appreciate you and the committee.
Thank you, Representative Hale. I appreciate that. And I appreciate Tennessee Donor Services as well. That's the TDS that we heard in your comments there. I'm one that, again, really encourages solutions to come by people talking. And I think that, that we're working in a good direction there. And I appreciate all folks listening to that. I heard in the comments to take the bill off notice. Is that accurate, sir?
Yes, sir.
Okay. Item number 12, House Bill 1916 will be taken off notice without objection. Thank you for your diligent work on this. Thank you. All right, we are now going to item number 13 on our calendar. Item number 13, House Bill 2474 by Representative Raper. You have a motion. You have a second. You are recognized, sir.
Thank you, Mr. Chair, and thank you for your patience. I was in committee. The purpose of this bill is to relieve the strain on employee shortage in the emergency management field. To give you an example, post-COVID, at one time, we have 16 employees employed in Bradley County, and we got down to 7. Okay, and employees with EMR certification shall be allowed to work as part-time employees, providing some EMT services. And those are just basic life-saving services, but especially driving an ambulance is the main one. And this was allowed during COVID years, but had a sunset provision on it. I'm asking the sunset provision be removed, and we go right back again. This will be at no cost at all to the state of Tennessee. This will go back to local as far as budgeting. And to give you an example for Bradley County, there is such a shortage of employees that it's already in the budget anyway. So it's their discretion whether to hire or not. So it's not going to be an added burden on them. If they decide to hire them, then that's all they have to do. And so any fiscal notes associated with this would be absorbed locally, but through the budget process. And I'll open it for questions.
All right. You have heard the explanation of the bill. Any questions or comments of the sponsor? Chairman Williams, you're recognized.
I think I remember the original bill correctly, but it allowed them only to drive, but not to provide medical services. Is that what this bill does?
Only basic life-saving services, yes, because they're an EMR, which is emergency rescue, which that's what they do. They're normally firefighters that are working part-time. And by the way, I did mention this is a part-time basis only. This, they can't work 2 full-time positions. Okay, so what they're able to do as a firefighter on a part-time basis, that's what they can only do in addition to the driving part.
So if I were a firefighter in Bradley County and I worked my shift, whether that's 312s or whatever, I worked that shift, then I could, under this bill, I could work an additional part-time shift.
That is correct, but it's only part-time, and it's only renewable on an annual basis. So if they decide that it didn't work out, then they don't have to hire you again the next year. So yes, sir.
You recognized?
Would they would, I guess what I'm asking is, would they pay appropriately as it relates to those overtime hours then? So if they worked a 6-hour shift and they'd already gotten,
It would not be counted as overtime. It would be a totally separate position as far as that's concerned. So it's not overtime. It would be of that part-time position. So
I guess what I would be concerned about is maybe liability upon the county's part if if one of those employees came back and say, wait, you owed me overtime for that period of time, for those additional 4 to 20 hours at time and a half instead of the regular time.
yes, sir.
I don't know that labor laws would allow them to do that. I guess but that would be my only concern. Obviously, I want to let the county do what they can do to make sure they meet the emergency service requirements. But I would be a little bit concerned of potential lawsuit going forward.
If you wish, I'll be glad to roll it 2 weeks and check with legal. And if I need to amend it to make that language better, I'll be glad to do so. So if that's your wishes.
Chairman Terry has some questions for you. Let's have Chairman Terry ask. You recognized.
Oh, thank you. I was just going to say this. I mean, this stuff it happens in medicine frequently where somebody's working at one job and then they take a shift somewhere else. So you're saying it's basically like a firefighter that's over here working this job, and then there may be a 6-hour shift on Sunday that they may do not this job, but just a separate job, and they're just going to be paid at their whatever rate they're going to be paid for their part-time work over here.
That
That's
is
all
correct.
is.
And if I may, I'm going to go back to Representative Williams 1 second. It was done during COVID. They allowed that, and that didn't seem to be a problem then, but I'm not saying it's not a problem now. I'm not disagreeing with you. I'm just saying it wasn't a problem then during when it was actually implemented during COVID.
I'll yield to.
Chairman Terry has yielded to Chairman Williams.
I agree, but if it were my business and I had somebody working 312s and then they picked up a shift later, then I would have to, if it was on the same payroll stub on the same one, then I would have to pay them time and a half. Under COVID, though, there may have been some kind of remedy because of COVID at the time, either in state statute or in the federal labor law. And so it would probably be good to just sort it out. I'm not trying to impugn your bill. I just don't want to open ourselves to liability that we may not exist, that the protections under COVID might not currently.
Yes, sir. And I appreciate that. At that request, Mr. Chair, I would like to roll it 2 weeks,
Okay.
please.
All right, and we've heard that, and we'll do a little work too. You may work with the attorneys on that just to
Yes.
get some clarification. And I believe the bill may have statewide application, so we'll just, although we're expressing the desire for Bradley County and just see what their experience has been through COVID and what it could be going forward as well. So
Thank you, Mr. Chair.
All right.
Thank you, Mr. Williams.
All right, at the request of the sponsor, House Bill 2474 will be rolled 2 weeks. 2 weeks it is. House Bill 2474 rolled 2 weeks. All right, ladies and gentlemen, we have a couple of pieces of legislation that the sponsors have not arrived. All right, items number 7 on our calendar, House Bill 2421 by Representative Shaw. We will roll that bill 1 week. And item number 16 on our calendar, House Bill 2502 by Representative Harris. Without objection, will be rolled 1 week. Any other business to come before the subcommittee? Y'all been very good. The motion is to adjourn. We are adjourned.